Hey, it's Dr. Nuesse from EasyDOTphysicals.com back again with another video. In this one, we are talking about the shy bladder procedure. This is a question I get on tons of my videos about what happens if you go in to give your urine sample for a drug test, for a mandatory drug test, a federal drug test, and you just can't provide a sample. So I'm going to go through step by step what happens and the potential outcomes, whether it be either an incomplete test or a, unfortunately, refusal to test, which does come with consequences. All right, now this can happen from time to time. It has happened in my office from time to time. It is annoying not only for the person trying to give the sample, but also for the person trying to collect the sample because it can be very time consuming. So here's what's gonna happen. You go in to try to give your sample, and one of two things could happen in this scenario, in this shy bladder scenario. One is you just can't provide a sample at all. You just tell the person collecting, the collector, that you can't provide a sample, or number two, the other thing that could happen is you do provide a sample, but it's just a very small amount and they cannot use the sample. So either way, you will go through the shy bladder procedure. If you can't provide a sample at all, they will continue to use that same cup that perhaps they were preparing for you. If you do provide just a little bit of a sample, but not enough, they will discard that sample. All right, so then the next thing that's going to happen is you are going to be given 40 ounces of water, a couple bottles of water, and you're going to be asked to sit in a secure area. You cannot leave. If you leave, that is a refusal to test. That is considered a refusal to test. You have to go through this shy bladder procedure in order for it not to be considered, or potentially not to be considered, a refusal to test. So you'll be sat in, we use like the waiting room or a different room where it's monitored, where you can't leave, and you will be encouraged to drink water, and you have up to 3 hours then to provide the correct amount that is needed to actually perform the test. So whether you are able to provide the sample before the 3 hour window or right at the 3 hour window, it doesn't matter. It's just 3 hours is the cutoff. So you don't have to wait 3 hours. It's any time you think that you can provide that sample in that 3 hour period of time. So then one of two things again is going to happen. Number one is you are able to then go to the bathroom and provide the correct amount. So the test is then considered valid and it goes off to the lab, and no problem there at all. The other thing that could happen is you still cannot provide a sample, even after drinking all of that water, even after waiting for 3 hours. All right, so then what happens at this point? Is this considered a refusal to test? Well, maybe. So this is the procedure at that point. If you go through the shy bladder procedure, you've waited 3 hours and you still cannot provide a sample, you will then leave the office, the test will be discontinued, and you'll have up to 5 days to be evaluated by a licensed physician. And that physician needs to come up with a reason why you couldn't provide the correct amount, why you have a shy bladder. And then that information is given to the MRO, and the MRO then makes the final determination on if the test is just canceled and then you can retest, or it's considered a refusal to test. And again, a refusal to test is the same as a positive test. And that, in a nutshell, is the shy bladder procedure and potential outcomes. Please check out the description of this video for my preferred home drug tests, and visit exploroacademy.com if you are concerned about an upcoming drug test. Until next time, everybody, stay safe.